Okay, let us discuss about respiratory medicine. And in today's respiratory medicine, we are going to talk about diseases we call chronic obstructive pulmonary diseases, which are associated with the cause of respiratory system narrowing, resulting to insufficient supply to the lungs, subsequently to the alveolar spaces, and subsequently to the blood, which can result to acidity because of lactic acidosis secondary to anaerobic respiration. So, in a normal person, the normal person has the normal airway, which starts from the nose, the nasal cavity, we have the sinus, which is main function is warm and moisture the air during respiration, and also to filter the air. Again, the air goes down through the trachea, to the bronchioles, the lungs, and the alveolar spaces where the gaseous exchange takes place. Now, in our normal person, that system will be able to contract and constrict and direct persistently to assist in respiration. But in another person, these airways can have a problem where the secondary to an inflammation process, this system gets thickening and results to irreversible airways narrowing, which can result to obstruction and difficulty in air flow, which can result in airflow. Now, the difference between these type of conditions and the asthma is that in asthma, the asthma, it is reversible, but in these conditions, it is reversible. The main tissues is the connective tissues, the collagen tissues, which are affected. So, in a simple way, is that chronic obstructive pulmonary disease is affected by air flow limitation, which is irreversible in a way. And these conditions may include including like examples of this one is like emphysema and also chronic bronchitis. Emphysema is the issue of the alveolus, and the bronchitis is the inflammation of the bronchioles, or even combination of both of them can have that problem. So we have chronic bronchitis, which is associated with excessive mucus secretions, often difficulty in breathing and with recurrent infection of the lower respiratory system, whereas emphysema is associated with a problem of the alveolar species getting destroyed. So in a normal person, you can see how the air goes down the alveolar spaces, very well the smooth muscles contract, so that they can facilitate airflow. Whereas in a chronic obstructive disease, the airways, the tissues here, the smooth muscles does not able to contract well, or where they constrict, resulting to obstructed airflow along the airways, which now results to narrowing, and that means there is insufficient air supply to the alveolar spaces, which can result to insufficient gaseous exchange. So, what are the risk factors associated with the chronic or obstructive pulmonary disease? People who have exposure to smoke, tobacco use are expected to around 80 to 90% associated with the chronic obstructive diseases. Whereas, remember, there is passive and active smokers, and also people who are at exposure of occupation, like people who work in film industries, like mining industries, like refineries, all those type of areas, ambient air pollutions in the stereo camp places, and also people who have genetic abnormalities like and deficiency of alpha antitrypsin enzymes in their body are at risk of developing chronic obstructive pulmonary disease. So smoking is one of the biggest problem or cause of that one in our setup. So the pathophysiology of those conditions is that there is noxious particles and gases in the environment where this person is living. This person is having host factors like congenital problem of that enzyme and trypsin enzyme. Then this process results to lung inflammation, or even the noxious particles can cause oxidative stress in the reticuloendothelium or in the mitochondria, which can result to cough, or it can also affect the antiproteinase, proteinase, and all those types of systems resulting. Also, you can see that there are so many factors which are playing parts in this condition of inflammation resulting to cough. So you can see that the lung is inflamed. You know the cardinal signs of inflammation in the matters, redness, loss of functions, sweating, and then the smooth air in as a mitochondria can get oxidative stress because of oxidative metabolism. So the clinical manifestation is that it is spread by two either coughing, smooth sputum production, and difficulty in breathing, especially on exertion. For example, climbing a mountain, running, all those type of things. Even sometimes people are associated with roads or weight. So the best way to assess this patient and make a diagnosis is that you have to collect enough history. You have to examine your patient properly. And the key factors in the patient history is that you have to ask for the risk factors like exposure to fumes, family history, smoking, either passive or active smoking, reason of smoking. You can ask past medical history like respiratory conditions like asthma, allergy, nasal sinuses, polyps, all those different conditions, or even the viral infections of the respiratory system. And also you have to ask pattern of symptoms development, what started with the chest start, then cough, then difficulty in breathing. Is there a history associated with the factors which are exhibiting the conditions? So that you can know, you can even do out things like cardiovascular diseases like congestive cardiac failure. So you have to rule out other places of other comorbidities, like we have talked about cardiovascular disease because of ecopulmonary, because of preroad and afterroad. Then also appropriate current medical treatment. If this person is on a current treatment like steroids, bronchodilators, antibiotics, and cancer, is the patient on the medications. So another point is that you have to impact of the disease on the quality of life. Are these people not going to the place of work because of a problem? They are having a breathlessness test. The children cannot go to school. The people cannot go to the places of work. So does this disease has a social impact on the life of these people? So is there support from the family members, from the society, like paying for insurance cover, NHIF, assisting in buying drugs, all those type of things are very relevant in this type of condition. So is there a potential of reducing risk factors like stopping smoking or relocating to a place where there's good air, like away from the industrial areas, all those factors are places of good atmospheric air spaces, because all these ones plays a big role. So again, you can do things like after taking the history, you can do pulmonary function studies where you do things like you check respiratory rate, chest expansion, all those ones. Then you can do spirometry. This one is measures how the strength you can flow the air. Then you can check the atrial blood gases. You can do a chest X-ray, and also you can do the enzyme of alpha-1 antitrypsin deficiencies expressed in the patient under 45 years. So what are the complications of chronic obstructive pulmonary diseases? Is that the patient can have respiratory insufficient and respiratory failure, which is a life-threatening conditions in most of the people. The patient also can develop pneumonia because of poor excretions drainage in the respiratory system, which can result to secondary bacterial infection or even viral infection or any other microorganisms, can result resulting to fluid in the alveolar spaces. Even it can result to things like pneumonitis, interstitial tissues can be inflamed. This one also can affect right-sided heart failure because the right-sided part of the heart is the one which supplies the lungs with the blood for the purpose of oxygenation. So in this case, the blood flows backward, then can result to congestion with the heart failure, left-sided heart failure, and also it can result to pulmonary hypertension because if the lungs are not functioning well, there is excessive fluid in the pulmonary circulations, then it can result to pneumothorax, can result to skeletal muscles dysfunction, and also can result to depression and the anxiety disorder because of the breathlessness. So the objective of management of this patient is that you have to know that this patient is having a difficulty breathing. You have to relieve symptoms and like using bronchodilators, or you can even prevent progression of the disease to the next stage, or you can even reduce the mortality and improve exercise and also prevent and treat complications. You should also remember to restore the patient's social life because they have to live, they have to go to school, they have to work. So you have to resort to think about reducing the risk, like stopping smoking. It's very important for people relocating away from where the stimulants or the risk factors are. It's very important to like go to the rural areas, away from the fumes, or even working in a section at the place of work where the fumes are minimal. So you have to give bronchodilators for the purpose to assist this person so that they can be able to breathe well, and they can be able. This one you can use either inhalers like salbutamol. You can also use one type of steroid type of inhalers are very important. That's an example of an inhaler which is commonly used. It's very common that such of somebody using an inhaler. So you can also use the steroids. You can also use the steroids, either inhaler or systemic, or you can even use things like a double monodrol for the purpose of IM injections. Other medications is that you can even use antibiotics if the patient is having bacterial infections. Other cases is that you can even, there is a study which says that you can give azithromycin 3 times per week to prevent the management of bronchial chronic airway obstructions. This patient requires some immunization to prevent diseases. So you have to assist this patient to keep away from exacerbations so that they don't stimulate difficulty in breathing because it's going to worsen the situations and result to stress in the body. So that is oxygen therapy. People are getting nebulized using a nasal mask. Oxygen therapy is very important also in this type of patients. Either sometimes the patient may require a long-term therapy of oxygen, and at this point that the family is recommended to have a rehabilitation method of at home so that the patient can be able to use oxygen at home. So you can even do surgical management, like you can cut parts of the air species which is affected is called blectomy. You can also do lung volume reduction surgery, and also you can do lung transplant. You can do lung transplant. You can do also pulmonary rehabilitations like chest physiotherapy. All those ones are very important. So the component of pulmonary rehabilitation is that you have to have things like education. You have to educate this patient, training on general exercises, breathing retraining, outcome assessment. You give nutrition, and also psycho support is very, very relevant. So the treatment concept of chronic obstructive pulmonary disease is that you reduce the factors which are causing this person to this type of problem, like reducing smoking, keeping away from the places which are stimulants like perfumes. You use bronchodilators, then you use either steroid and also pulmonary rehabilitation, and then finally surgery as a way, as our last option. Just remember that you never do surgery unnecessarily. So the law of nursing in COP management is that they push us, you know, that nurses are the key because they're the custodian of our patients. So they have to monitor the patients, check the progress of the patients, teach the patient, rehabilitate the patient. All these ones are very important in nursing care. So all those ones are very important. You can even know how to teach the patient on them. Like this is breathing exercises. They have to be taught how not to do breathing. You have to assist them to inspiration muscles training. You assist them on how to do exercise of the breathing. Self-care activities is very important also to be trained by the nurses. So oxygen therapy, either at home or at the hospital, is very important because this one is going to give the patient a relief. So nutrition support is very important because you have to advise the patient to keep away from the food which are predisposing to these attacks, and also we have to give food which is going to improve the immunity of your patient, to improve the patient of the patient. So the nursing diagnosis is that ineffective bleeding, pattern related to the chronic care limitation, or if the patient is having ineffective ear clearance, list of infections, all these ones is very important in nursing. Then balance nutrition, and also you teach on knowledge and the self-care strategy, which should be performed at you. So basically, that is all about chronic obstructive respiratory diseases, which have seen that it is associated with either emphysema, both the alveolar species, or chronic bronchitis. Smoking is a key factor. Chest rehabilitation is a key factor. In space of the growth. Thank you very much for listening to us for listening to this topic about chronic bronchitis. Thank you very much.